First of all, we're going to start by talking about women and heart disease. It's a more common problem with women than men, correct?
Surprisingly, that's true. When you look at heart disease, it remains number one killer among all Americans outside of cancer, outside of all other deaths. 1/4 of all deaths are related to heart disease. And women have a somewhat of an alarming trend, is that they're tending to have a little bit more death when it comes to heart disease. And that,
part of it is the symptoms are different than a man's symptoms, correct?
absolutely, and that's the concerning thing, is the alarm bells with women, you don't get the same symptoms. The alarm bells, which we typically think of, substernal chest pain, is where I'm having a heart attack and this is, I need to get help. Where women have more subtle type of feelings. They have back pain, more shortness of breath, and what they do is they wait a longer time to get help. And that time destroys more heart muscle, and the women tend to do worse over time.
So what's your advice to women then?
To know what the symptoms are. So it's not always substernal chest pain. It's not the man's disease, is what was thought for many years. It could be more subtle. If you feel that something's wrong, you're getting shortness of breath, the jaw pain, the back pain, seek help. Don't just put it off to something else.
What are some of the risk factors?
So typical cardiac risk factors, I put them into two categories. One are the things that are modifiable and the things that are non-modifiable. The things that are non-modifiable are family history, age, and women, postmenopausal status, and male being a male. The modifiable things are typically hypertension, high cholesterol, diabetes, smoking, obesity, and inactivity.
What about stress in our lives?
Stress definitely plays a fairly big role, and it's more of a role as we get more stress, we get some of the risk factors that are modifiable, the high blood pressure, those types of things.
And what can I do to reduce my risk factors,
Well,
men or women?
Well, I think it's important to really talk to your physician about what you can do. Know what your risk factors are. I have all of my patients understand what their goals are for cholesterol, what their goals are for their blood pressure, what a heart-healthy diet is, how to exercise more and do it safely.
Thanks for the heart-to-heart talk. That's Dr. Tim Malins.
Appreciate it.